Many thanks for staying tuned. It's still the conversation here on Lagos Television. We did tell you before we went on that short break that today we'll be taking a look at the pains of increasing cost of medical care on Nigerians. And I did also mention that at the moment, just pray to have good health, because what it is to buy the medications that we thought were normal right now is not as cheap as they used to be. And I gave an example of buying a typical cough medicine, which used to cost about 250, 300, not less than at 1,000 naira at the moment, depending on the brand of what you're buying. But how many Nigerians can actually afford, to spend, hard-earned money on their medical care at the moment? But we also need to have top-notch health to also be able to go to work and continue to make money to take care of ourselves. We do have a guest in the house this morning, and together we'll be taking a look at how we got here and perhaps if there's any way or any means of living the situation soon. We have joining us today Dr. Benjamin Oluwojebutu. He is the first Vice President, Nigerian Medical Association, NMA. Thank you for being here on the program today, Doctor.
Thank you very much for having me. How are you today?
Very well, thank you. Okay. Of course, we know that, like the saying goes, a healthy nation is a wealthy nation. So if you're not okay medically, then you will not be able to make a living and you will not be able to contribute meaningfully to the growth of the nation. But how did we get to this era where it is becoming increasingly difficult for Nigerians to enjoy medical care on I don't even know how to put it.
I got you.
On an affordable scale.
So first things first is the truthfulness of the government about healthcare.
Okay.
Budgeting has been dwindling since the last few times. We don't pay attention to healthcare in this country very importantly. We have more ideas about what is more important in the nation, which is more security, more infrastructure. And I told them, I said, even if those that are securing the nation, we are not very healthy, they cannot secure anything.
Sure.
And as we have tried to say to government that budgeting is one of the most important things to do in healthcare. You prioritize primary healthcare, you prioritize secondary healthcare, you prioritize tertiary healthcare, and people can begin to afford it. Because if the funds are available for the people and they are available for this area of healthcare, it will reduce their buying cost and buying power. But obviously, and I'm glad when government says that there's now autonomy of local government. But how accountable are the local government offices? Because obviously the local government are the one that should take care of the primary healthcare centers. But are they funding it properly? Are they accountable? Is the money for the healthcare, is it going to the right places? It's very important to note those very important things. So for me, we need to be very clear about what is our personal vision as a nation in healthcare. What do we really want to do? People cannot eat properly. If you can eat properly, you can't get well. So the level of economic hardship now has affected every facet of the things. So, for example, now drugs are supposed to be produced in Nigeria. The raw materials are not available now, so you have to import it. If you import it, how do you make money? How do you make money? Because the exchange rate is going high. You can't want to do business and go at a loss.
Not make profits. Right.
So people have to look at it. But if government says, okay, let's drop import tariff for drugs coming to Nigeria. Let's drop import taxes for all the healthcare pharmaceutical product, equipment being imported in Nigeria, and determine that, okay, we as a nation, we want to start building our own industries that produces this thing. We have the material, but we are not ready. We're not enthusiastic about ourselves. Maybe our belief system is what is happening to all, because we have been used to importing things. We have been able to just dwell in it. We don't think we can produce anything in this country. Even when there's the guys producing producing the cars. We all know them. I don't want to call their brand. Even the government don't even buy from them. Because it's a natural, they don't believe that homegrown Nigerian has capacity to do what they're supposed to do. So for me, healthcare first thing is that the government must realize, must prioritize that funding healthcare, budgetary allocation to healthcare, and accountability is the fundamental fulcrum of helping Nigerians get right healthcare. Because if the budget is very, very, very good, is robust, the funding will go down, will trickle down from every part of the facet of Nigerian. Okay. The doctors, the nurses, the healthcare workers doing the work are happy to do the work. They will not charge excessively for their expertise because there's a cushioning effect of there's light. They don't have to pay for light a lot. I'm sure you heard about UCH Ibadan. That you have for a long time.
Bring generators.
So those are the things. Those are the things that increase the cost of healthcare because the enabling environment is not available to solve these very little problems. That I think if government is passionate about it, we can solve it.
Okay, beyond the problem of budgeting, like you rightly identified, there are no infrastructure, and even when there are infrastructure, as in hospitals and primary healthcare centers, you go in there and you see that they are empty. The basic facilities and equipment, they are not there. And oftentimes when you go there to go and do simple tests, they will refer you to a private facility. So what are the dangers that we are likely to face as Nigerians if things should continue this way? Because Nigerians are already looking at options. If you are supposed to take a particular medication twice in a day, because it is expensive, you'd rather take it once to save your money. So what are the dangers that we are likely to face as Nigerians?
I'm afraid, Jibala. I'm really afraid. Every day I cry in my small closet because we keep having an increment in the population of this country. We are over 200 million now because everybody keeps getting large, and we have influx of rural migration. So the cities that are supposed to cater for fewer people are getting more. Number two is that people are now beginning, because they cannot afford, they're not using all sorts of herbal medicines. Going to chemists, going to traditional people, and trying to juxtapose traditional medicine with what the orthodox medicine is supposed to be using regularly. And you do know what happens to them? They now become worse than they started. For example, some of the drugs they take, they'll say, take 15 mils of this medicine. It's for typhoid. Take 15 mils of this, 30 mils is for malaria. Take 50 mils is for diabetes. So those things they are taking, they don't even know what are the ingredients in those things they are taking. So for me, it's also what we call health-seeking behavior. So if you make the atmosphere, the environment enabling for people to see, okay, I'm supposed to take this drug. Let me give you an example. Somebody's hypertensive or diabetic. He might take this drug once a day. And now, because he cannot afford, it has jumped from 5K a month budget to 35K a month budget. How much is his salary? Think about it. How much is his salary? How much does he pay for school fees for his children? So he'd rather take care of his children than take care of his health. What happens is that the hypertension now begins to get worse and the kidney will fail. When the kidney fails, it now becomes more money to reverse the kidney failure. Eventually, the patient dies. So those are the things that we have to look at as a nation. What are the indices of the things we are doing as a policy? Who is it affecting? The common man. Because the common man cannot stand there and say it's going to abroad for a kidney transplant or it's going to abroad for a medical checkup. It's the right of duty of government to make healthcare very basic for everybody. Right. As I've said, you go to a primary healthcare center, the basic equipment are not available. But there's a budget for it now. So the local government are taking money now directly from federal allocation. Where is the funds going to? And I say very, very clearly, if the politicians are determined to change the healthcare space, they will do it. If the local government chairman...
it's a political will.
Yes. If the local government chairman says that, I want to make this PAC function, and says, I, as the head of this local government, I'll go to that place once a week to check my blood pressure, once a week to check my sugar. and people see you go there, people see you use the place,
Right.
people see you go there regularly, you would know that there are these facilities that are available and you are empathetic enough to provide them. When you start going there, it becomes popular. Your other people that are following you will go there. Most times, even the PhD are moribund. Nobody goes there because why? The owners of the primary school don't even use the place.
Right. Okay. So, because while you were speaking just a moment ago, you mentioned people would go to, rather than go to the health facilities, they would rather go to the pharmacies. And so this will also lead to the abuse of OTCs, you know, off-the-counter medications. Ordinarily, there are some medications that you should not have access to without prescriptions, but that is gradually dwindling again because people will say self-medication, and of course will go to the pharmacist and say, prescribe me a drug because I cannot afford to go to the hospital. So if we're talking about, you know, OTCs, abuse of OTCs and issues like this, are there measures that we can begin to put in place vis-a-vis preventive healthcare alternatives so that there might also be a reduction in the need to want to go to the hospitals?
You remember back in the days when we were younger, there used to be National Orientation Agency.
Yes, the NOA.
That talks about every major things in this country. When there's an emergency, when there was diarrhea of the, you remember that baby picking back in the days, then there was something about it. I don't see them talking again. We had diphtheria in King's College that made some people died. Nobody talked about it. So we need to start having what we call health-seeking behavioral conversations that are, you know, that are done in different languages. People should know awareness.
Okay.
Awareness is very, very important. So if you have agencies that are meant to do this thing and they're not doing the work, then they're not doing the work properly. You train them or tell them what they need to do.
Okay.
There's no awareness. So now, what you talked about pharmacists is important. I know the Pharmacy Council of Nigeria is regulating that and they're doing well. But my challenge is the chemists. So they're not the same thing.
True.
A pharmacist that is very solid, a trained pharmacist would ask you for a prescription, obviously, because they know that's the rule, that's the game, that's how to do it. But a chemist, because he wants to just sell the medicine.
And they do apprenticeship.
So the chemists, because they want to just sell the medicine, they only treat the symptoms and not treat the disease. Because they don't know how to ask questions or clerk you or take history. So you just come and say, you have a headache. They say, okay, take a headache medicine. Whereas the headache might be because your blood pressure is high, or because you're not resting properly, or because you have malaria, or because you have other problems. So, but as a doctor, that's our job.
That's the training.
The training is to take all the symptoms, all the signs, and do what we call physical examination, so that you compare what you have examined on the patient, what the patient is saying, and make a diagnosis. It's the diagnosis that you treat, not the symptoms. Most chemists, because they are profit driven, they want to treat the symptoms. So they can give you 10 medicine, one for each of the symptoms. They say you have stomach pain, they give stomach pain medicine. They say you have headache. Because for them it's about profit.
Right.
So because Nigerians don't know, because they're not aware.
Right.
They just think,
and
thank
they
you.
also
And
believe
people
that
always
once
tell
they
them,
go to the pharmacist.
let me tell you, people believe that it is the volume of the medicine that makes you well. I'm telling you. What you cooking for me? Sorry, I'm saying Yoruba. They don't give me. They've given me plenty medicine. They're taking medicine, I'll be well. Whereas it's not the amount of medicine, it's the quality, efficacy of the medicine, and how you are using the medicine. Because every medicine has what we call polypharmacy, it has dynamics, it has pharmacodynamics, pharmacokinetics. So how your body also responds to the medicine is also very, very important going forward.
Sorry, Jibola, and just to add up to that, how important is it also for people to ensure that they finish their medications? Because sometimes you also give people medicine, and once they take 1, 2, 3 and they feel better, they say, I'm okay, and do not go ahead to finish that prescription like it was properly prescribed. So how important is it for people to ensure that they finish up?
It's very, very important. As prescribed by a health physician, you should always finish your medicine, even when you get better. You know why? Because your body cannot begin to react to it if you don't do that. That means if your body now becomes resistant to that medicine, if you take it next time, it will not work again. You must finish the medicine, even if you get better on the first dose. That's why I wonder why people say, doctor gave me a hypertensive drug for 1 month, and I did it for 5 days, I'm okay. there's what we call rebound hypertension. So you just stop the medicine, it just rebound down, it becomes too high. You know, see a man driving the car on the road and you see that just suddenly collapse and says you're honking the horn and you don't know that man is already dead because he didn't take the proper medications, he didn't take it properly because he felt he was doing better. You know, and it's also important we educate ourselves that these issues of using herbal drugs anyhow, or drugs that you think is labeled, or they do on internet now tell you, people just tell you a lot of stuff to cure a particular one. They say
cure everything.
Cure everything. One will wash your belly, one will wash your tummy, one will for erectile dysfunction. Many things happening now. Those drugs most times have other effect on the body. You know, they can have effect on your kidneys, on your livers, and you don't know, you can take that drug gradually, one day the kidney just stops working. So it's important as a people. Awareness is very key. The government and our people. So I also want to say that the philanthropists, the people that are well-to-do, should also please, if they can, if they can take one of the PhDs in this country and adopt them and say, okay, this country has made me. I'm grateful.
So you know, giving back.
I saw one thing Adegua did in also over the weekend. Amazing. That's what people should also think about what they can do for Nigeria, or know what Nigeria can do for them. A lot of our politicians, a lot of our people always think about what Nigeria can do for them. I beg of them now, let's start thinking about, because one day people will be tired enough and they will leave the country and medicine will go into extinction. Because every doctor now, every pharmacist, every nurse, they're looking for better pay, better welfare packages. They're leaving the country in their droves. One day there will be no doctor to see us again because we're not thinking about the country as a people.
Okay. I'm happy that you mentioned primary healthcare centers. Recently, there was a statement from the presidency over the plan to build 8,800 PHCs in the country. Would that be enough? That's one. And from the body language of this government, is there any clear-cut policy that is tailored towards reducing the cost of Medicare on Nigerians?
So I think Ministry of Human Resources was talking about giving some people some kind of cash. And now one of the reasons why Federal Ministry of Health was added social welfare were this part of it, of vulnerable people, very elderly and very young, under 5 children. I think there's a policy, but it's not the implementation. Who is implementing what? How are they implementing this? Where are they implementing it? So we're building 800 PHCs. The ones we have we equipped it? The ones we had, are they managed by medical doctors? The ones we have you given life to them? So why are we duplicating things and spending expenses on things that we have some already that we have not even utilized properly? Even in Lagos, there are some that are not as functional optimally than some. And it's also the willpower. Some of the chairmen of local government chairmen are very driven and says, you know, this must work. It's for my people. You know, they are driven. Some are not driven because they don't care about it. So it's important that as a government, it's not just about bringing up policies, building buildings, about what is the efficacy, what is the pragmatic approach of the ones that we have built, how functional they are. What is the accountability process? So who is accountable for? So we have 7 for local government in Nigeria. We should have at least 2 or 3 PHCs in the country as of now. Who is accountable for this? Who is accountable for immunization in those places? Who is accountable for drug supply in those places? Who is accountable for manpower in those places? Are the manpower, are the doctors, nurses, pharmacists working there? Are they getting the same pay according to all their different partners or different members in other facility? So why will I work in a rural community where in a rural community and my friends working in urban communities is looking very good? Why will I work in a rural community? So I have said it in several for that government must give incentives to people that say people that work in rural communities and take care of the lives of those people in those communities. It's not convenient for them, but because they are passionate about staying there, is where maybe they went to school, maybe that community gave them scholarship. Some doctors, community get on scholarship, some nurses, some pharmacists. So when they finish medical school, when they finish training, they want to go back and give back to them. But if they say they're going to stay back in that rural community, it is important for government to say, okay, we appreciate you, and give them some form of incentive to make them feel loved, feel passionate about doing what they're doing. Government should take healthcare very seriously. It's important. It's not in building things. It's in creating an enabling environment for people to do their work, and for the citizens to see that, okay, there's a tangible, I have a wife that is in labor, and I can go to a hospital at 2 a.m., a PhD, and I can get a doctor to see me, and I know that my wife and my baby will be well. Right. Simple, basic healthcare that will change the narrative that government is for the people, and by the people, and with the people.
Right. So again, because we've talked about the fact that at the moment there's a lot of pressure on families and how much they also can part with when there are health issues to be attended to. What is the role of the insurance policies or the out-of-pocket payment options, especially here in Lagos? And I also do know that there is the National Health Insurance Scheme. What is the role or the place of such schemes when you talk about health care?
So I'm glad that General Mahmoud Buhari, before he ended his tenure, changed NHS to NHIA. So it used to be National Health Insurance Scheme, now it's not National Health Insurance Authority. The law has said that every Nigerian that breathes under this breathes air in Nigeria, lives and works in Nigeria, must have an insurance.
Okay.
And also, and most states are trying to domesticate it, but Lagos has domesticated it.
Right.
And I'm glad what Lagos is doing, with Lashma. Lashma is doing a lot of work with Ilera Eco and everything. But we need to do more. We need to do more because most of the times Lashma is locked, most of the insurance are locked with civil servants, and the informal sector don't get into those spaces because they're not well informed. So we need to do a lot of more awareness and let them know that insurance is about helping you save money when you need to get help. People say, why am I putting money, I'm not getting sick. But one day, maybe your child will need it, yes. So it's important people to understand that insurance is the game changer. Government should invest in insurance. Okay. Government should invest in infrastructure, and should give the providers adequate funding to help them in this. For example, so an NHIA can guarantee investment. Okay. Because it's a pool of funds. And that fund can guarantee, okay, we can say we have maybe 90 billion. And this 90 billion can help give us maybe a guaranteed loan of about 180 billion, but for the people. So we can say with this fund will not be fund for vulnerable people. There's a BHCF fund that comes from the National Primary Health Care Agency. But how are we using it effectively? Okay. So we can use Lagos as a yardstick, very good. But what happens to places like Zamfara, people like in Sokoto, people like places like in Adamawa, where you have a lot of rural communities, how they access healthcare. And you know that one thing we must do in this country, as a people, there must be balance of forces. All of us must see ourselves as one, as Nigerians, and solve the problem per the people. So that everybody knows that it's not just using one particular region to solve the problem. Everybody feels that there's healthcare indices is poor. It must be general. You don't say because Lagos is doing well, you think Lagos is just to measure healthcare impact. It has to be general. What's happening in those rural communities is very, very important because people are more there than in urban communities.
How about sorry, Jibola, just a follow-up. So how about the HMOs? Because again, sometimes what they cover differ from one another. Yes, so should that also be a blanket check, or should it also be looked into so that what you're contributing is also what you're able to have access to?
Yes, so I think all the policies must change. I know that they met with NHI a couple of weeks ago about reviewing the medicines, reviewing the cost of healthcare, also reviewing HMO, and also properly monitoring the HMO. Some HMOs get money, they don't give the service. Some don't give the adequate service because they want to make up profit from it. So there's not, the new DG is trying to reorganize this and make sure everybody knows. And it's important that Nigerians also ask questions from their HMOs and from their providers, what they actually cover. Let them know. So when you know what you covered, then you can get the services you demand for.
Okay, even if the government should change the budget cycle, have infrastructure and facilities, what about the shortage of manpower? We read a particular news point this morning wherein the Honorable Minister of Health, Professor Patrick, complained that a lot of our health professionals have jackpot abroad.
And they're still
going. So even when the infrastructure is there and the facilities are provided, who are those that will man these facilities? That is one. Then is it not time for us to start looking inward, to start producing some of our things locally, especially some of these medications?
Let me give you a scenario, Jibala. And I find it very painful. Government promised Nigerian doctors commerce arrears, 25%, 35% arrears increase since last year, since maybe July last year, and we've not still been paid. So people cannot hold government now and say government is truthful to what they are saying to us as doctors, as healthcare workers, because and we don't want to go on strike, because strike is not the answer to healthcare. We keep having meetings, engaging them, and they're not doing it. So people will leave because they don't even trust government anymore. Because government said they will do this, they will not do it. They're not doing it. So people are jackpotting. Now, it's supposed to be one doctor per 6,000 patients. But we have one doctor now per 40,000 patients. Doctors are dying every day because of overwork. Nurses are dying every day because of overwork. Farmers are dying because of overwork. Now, who is also supporting their families when they die? So you have to sit down and look at it. What makes sense to you as a person? Do you want to work until you die, or go to a system that even when you die, your children, your wife is supported? So people think about it rationally. Only few of us that are very passionate, few of us are just very passionate, just addicted to Nigeria and says, okay, we cannot go anywhere because we must build this country ourselves. But if you keep saying this all the time and people are getting tired, one day they will get what we call a breaking point and they will leave.
Right.
Now, I'm glad they've said that they want to increase the carrying capacity of schools to produce more doctors. Excellent. But have you talked about the carrying capacity of the trainers that will train them? So you want to have doctors coming, more doctors, more medical students.
Right.
But how about the trainers, the doctors that will train them, the consultant, the quality? So you must do it pari passu. If you are going to increase the medical students training, you must also increase the capacity of those that will train them. It's important because you can't say that you want to only serve the populace and not take care of those that are serving those that want to serve the populace. It's important. I've lost friends during ward round. Last 2 weeks, we lost one of our very good cardiologists in National Hospital. He died while working from embolism. It's stress. So it's important that government takes care of us as a people and believes that this is what we must do together. It's important. And I tell you, if we don't make it an emergency, very soon, there won't be doctors again in this country. I can tell you that.
What about looking inwards for the production of some of these drugs?
It must be, I say it's political will. You have industries in Agbara, we know now. We have industries in Onitsha, we know. If the government empowers these people with the raw materials and make sure that the raw materials are very, very available and cheap, they are doable now. I remember a particular pharmaceutical company. Okay, so you know the pharmaceutical company that came to Nigeria, the big ones, when they came in 1974, the contract was that when you're leaving the country, you must have left an industry that can replace what you have gained in the country. But because we didn't follow them up, we didn't make sure that those contracts were obeyed. Because they were paying tax already, and that's okay for us. They were paying import tax, that's okay for us as a government. We didn't look at the long term. Now, they all came now and left without, and even left owing Nigerians that work for them. Are you getting my point?
Yeah.
So as a government, is the political will that we want to create an enabling environment for drugs to be produced in Nigeria at minimal cost. We will invest in it. Invest as a government. Invest as a people. And those that want to invest in it, give them an enabling environment to make them invest. And it will also improve employment.
Right. So these issues that you've raised, have they also been largely responsible for the high number of fake medicine, fake products that we're also witnessing? Because sometimes you go into a pharmacy, you want to buy a particular medication, and you get another generic name given to you, and you ask questions. Why are you giving me this one? And they tell you it is the same thing. It is the same generic name that they have. And you're wondering, will it be as efficacious as, you know, the other ones? And so is this part of the worry
It is.
that NMA and other doctors who are still here are also going through?
We're worried about it, obviously, but you know, you cannot control the buying power of anybody. You can also control the buying power of those that are selling. So I say one thing. NAFDAC is trying. But when NAFDAC goes to lock up fake places, they always lock up the places and give a value of what they locked up. They will say, we went to this particular area, we destroyed 30 billion worth of this. I think that's not right. You don't qualify fake drugs by the money that you destroyed. You should qualify by the lives that you have saved, or life that's about to die if you don't do that. If they are
consumed.
Yes. So what I think they should be driving at is that because of these drugs that we destroyed,
so many
of Nigerians' lives have been saved in this particular community, because we realize this constant drugs that are fake in this community has caused this, that, and that. So you don't make it look as if you are trying to make people lose money, or you're trying to gain money for government, but you're trying to also save the lives of the people that will have died
if they consume the medicine.
A lot of our young people are having mental stress, mental things because of some of these drugs that are coming in, some of these mixtures. They're calling many names now, Loud, SK, many names that are coming to the country. Now, if you destroy them, what you should say is that we have been able to secure the lives of over 3,000 youths that will have taken this thing. Because if you calculate what was destroyed, it was meant to be taken by maybe 3,000, 4,000 people. But we have destroyed it because we want to protect 3,000 lives of young people that will become president, that can become governor in the future, because it's about them, not about the amount of money that was lost. So for me, the fake medicines have an open route now because people are agitated. People don't have money to buy real ones.
Right.
So anybody that is a bad person will seize that people's opportunity now to just do fake things, or they will do what is not efficacious. They will do under. So that way they will tell you, take this or take this. So it's important to you as a person. I like you, ask questions. Why are you giving me this? Is it the same potency? You look at it. You look at the paper and how many milligrams of each of them are inside. So if it's the same thing or just change of name, it might be okay. We just had, maybe the person producing it or the country producing it from, the cost of production is lower. You can't produce a drug in America and produce a drug in China. You can't be the same thing. So, but it might be the same drug, but because of the cost of production, might give you a reduction in the amount of money you're spending.
Okay.
But always ask questions. Before you buy any medicines, always ask questions. Make sure you're taking the right medicines at the right dose, the right efficacy.
Okay, quite a number of Nigerians now, they are poor because of the economic situation of the country, and they are resorted to an option of taking agbo and different kind of things. And I'm sure some of them are watching us right now. How would you advise them, even though these medications are very, very expensive? But if you continue to take this kind of mixtures here and there are dangers ahead for you. So what will be your message to them this morning?
I want to crave your indulgence. And first, I want to say, Nigerians, please, your health is your very, very own personal drive. You must take care of yourself personally. God has given you your life. Your life also is in your hands. No herbal medicines is good for your body because they cause more harm than good. What I advise people now, even if you have a lot of money, eat balanced diet, eat what you can eat. Please don't worry too much. Exercise yourself once in a while if you can. Don't worry too much because the worry itself can cause problem. Do what makes you happy. Music, dance, just do it. because eventually it's about your body.
Right.
If we keep talking, saying government, but you must also take full responsibility of your body. Yeah, I see we entering Muluwe, calling a lot of drugs to buy because they look cheap. Most times those drugs can kill your kidneys or affect your liver. I beg of you, let's take full responsibility of our life. Thank you.
Okay, but finally, before we allow you go, again, because you belong to an association, the NMA,
Yes.
is there any role the NMA also plays in ensuring that you hold government more accountable, not only the federal government now, all strata of government officials responsible for the kind of healthcare delivery that they give to the people?
Yes, yes, excellent. NMA is on the front burner. All the state chairmen are doing a lot of work. Some of the chairmen are even, some of the governors are listening now. I know I hear Kwara State governor has done well with paying the arrears of the doctors. They're happy.
Okay.
I heard Kano has done the same thing. I heard Ebonyi is doing well too. Lagos is also doing very well. So there's a lot of engagement with all our states, but we must just centralize it and make sure that government is accountable to whatever they say that they're going to do for the people, and make it let them do it early enough, because people are getting tired.
All right, we'll have to leave the conversation here this morning. Thank you so much, Dr. Benjamin Olujebutu, First Vice President, Nigerian Medical Association, for finding time to be here with us on the program today.
Thank you for having me anytime.
All right, that's the much we'll take on the conversation this morning, but just like the doctor said, worry less, because if you worry too much, there's really no gain in worrying too much, and what you cannot help, just leave it. And, you know, let's just keep being hopeful that it will be a better tomorrow for us all. We'll see you again after Joy's conversation on the Lagos side. Please stay tuned.